Welcome to this GROW module concerning the health record requirements for Piedmont Tech nursing and health science students. Students who enter the nursing and health science programs learn the skills necessary for their career by combining traditional classroom lecture, hands-on training in a lab environment, and real-world clinical experience. Because these students will be involved in direct patient care when they go to a clinical site, certain health requirements must be met. These requirements may be due to government regulations, industry practices, or specific preferences of the clinical site provider. Regardless of the reason, each student entering a healthcare-related program at PTC must provide documented evidence that all the requirements have been met. There are a number of requirements to complete, and it can become confusing for incoming students. Therefore, we created this presentation to help you better understand what you need to do to be in compliance. Bear in mind, if you do not recall everything that is covered today, you may go online to refer back to this presentation at any time. Go to www.ptc.edu/health-science-resources. Each student who accepts the offer to enter a nursing or health science program is given a health assessment packet. This packet will guide you in obtaining the appropriate documentation and also serves as documentation for some of the information needed. The front page is a cover page, which will serve as your checklist. As you collect each required document, you can check it off on the cover page. After the cover page, you will see 3 more pages, which are health assessment forms that you will need to submit once they have been completed. The first page is a student information form. Page 2 covers the physical and mental requirements for your program, and page 3 is a form that will document the results of a physical exam that you will need to have completed. Let's discuss each of the parts of the packet in greater detail. As we mentioned, the first page you see is a cover page and is designed to serve as a checklist of the documents that must be submitted by the deadline. The deadline date set is usually the date of your program orientation. The first item noted is your physical exam. Next, it references the physical and mental requirements. In the middle of a page is a list of the immunizations and/or titers that must be submitted. Finally, some additional program requirements are noted at the bottom. Let's take an up-close look at each section of the cover page. In the first paragraph, we are reminded that these documents are all required in order to enter the program. The documents submitted must be originals. Faxed records are not acceptable. Contact information for the PTC Health Records staff is noted here. Contact your health records staff member for clarification about these requirements, or if you wish to submit your documents ahead of the deadline date. Nursing students, both practical nursing and associate degree nursing, should contact Cindy Fowler, and the students in the remaining healthcare programs should contact the health records staff member in the health science division, Denise Wiley. Moving down the page, the next items on the checklist are the physical examination and the physical and mental requirements. As we move further into the packet, we will discuss these requirements in more detail, so we will skip them for the moment. The center section of the page contains a list of several immunizations and/or titers that are needed. Students are required to show they have been immunized against certain diseases or that they have had a positive titer drawn to show sufficient immunity. This documentation must be submitted on a state-approved certification of immunization form from the health department or on your healthcare provider's official letterhead. A copy of the lab results must be provided to show a positive titer. You have probably already had some of the required immunizations, so the best way to get started is to go to the health department to look up your childhood immunization records. The first immunization series noted is MMR, or measles, mumps, and rubella. This requires a series of 2 immunizations or lab results indicating a positive titer. The next immunization is for varicella. This also requires a series of 2 immunizations or a positive titer. Simply reporting that you have had chickenpox is not sufficient. Hepatitis B requires a series of 3 immunizations or lab results showing a positive titer. You must have had a tetanus immunization within the past 10 years. And finally, you must be tested for tuberculosis or TB. This requires a 2-step PPD. Only one PPD will not suffice. The 2 TB tests must be administered 1 to 3 weeks apart, with the results read within 48 to 72 hours each time. The documentation required includes the dates the test was applied or administered, the dates the results were read, and the actual results recorded in millimeters. If a student's PPD results are positive, then the student must also submit chest X-ray results and documentation of prophylactic or preventative treatment dates. After the initial 2-step PPD requirement has been fulfilled, students are required to have a PPD annually. The only exception to the PPD requirement is the Veterinary Technology Program. Vet Tech students are only required to have a 1-step PPD. At the bottom of the page, several additional requirements are noted. The first item is cardiopulmonary resuscitation or CPR. Vet Tech students will not need to complete CPR, but all other nursing and health science students are required to complete the CPR for healthcare provider training. Regular CPR training is not acceptable. It must be CPR for healthcare providers. If you already have CPR certification, contact your health records staff member to see if it is the appropriate CPR. For those who need CPR training, it is offered prior to every semester as a 1-credit-hour course, AHS 106. Incoming students will be notified of the date and time of this training. Once certified, your CPR card will be good for 2 years. However, students are required to watch a CPR refresher video at the 1-year mark. All students must complete hospital orientation, which will teach you about bloodborne pathogen precautions as well as HIPAA regulations. This training is required for clinical participation and must be renewed every year. Hospital orientation is provided prior to each semester and the date will be announced. Uniforms are required for each program. In order to ensure consistency, uniform reps visit campus and perform fittings for each program. The date for your fitting will be announced and the cost will be communicated to you. In addition to the requirements noted on this checklist, your specific program may have additional requirements. If so, those requirements will be communicated to you. Although our health records staff members are very reliable, it is a good idea for you to keep a copy of the documents you submit. The remaining 3 pages are the actual health assessment forms. The first page is to be completed by the student. Please clearly print the requested general student information. Note your program, student ID number, and the date. Print your name, including your maiden name if applicable. Please include your date of birth, mailing address, reliable phone number where you can be reached, and your email address if you have one. Also, please indicate who we should contact in an emergency and provide their contact information. Next, read the declaration statement and sign your name and date it. At the bottom, please note any allergies that you may have, and for item number 2, please disclose any medical conditions of which your instructors should be aware, such as seizure disorders, infectious diseases, diabetes, and so on. Print your name on the line at the end of the page. The next page is also to be completed by the student. This page contains a table that shows the physical and mental requirements for each program. Across the top right side of the table, the programs are listed. Find your program, and the column located directly beneath it will show the amount of time you'll be expected to be able to do each activity listed, with O meaning occasionally, or 1 to 33% of the time, F meaning frequently, or between 34 and 66% of the time, and C meaning constantly, or 67 to 100% of the time. Let's use radiologic technology, or RAD Tech, as an example. We see RAD or RAD above the second column, so everything noted in the second column applies to Rad Tech. Let's just look at a couple of the requirements for that program. The first activity mentioned is the ability to lift up to 50 pounds when lifting patients, supplies, or equipment. As we move across that row and look at the letter found in the second column, we see that students in Rad Tech must be able to lift up to 50 pounds on a frequent basis, or somewhere between 34 to 66% of the time. The bottom third of the table is a breakdown of the mental abilities needed. For example, how often would a student in the Rad Tech program need to maintain composure while managing multiple tasks? By focusing on just the information listed in the second column, we see that a Rad Tech student would need to be able to do this C constantly, or 67 to 100% of the time. Once you have reviewed each and every activity and you understand how often you must be able to perform each one for your particular program, then sign the page at the bottom and enter the date. Print your name on the bottom line. The final page of the packet is page 3 and is the one that must be completed by your healthcare provider, either a physician or nurse practitioner, to document the results of your physical examination. Write your name at the top of the page on the line provided. When you go for your physical exam appointment, give this page to the person performing the exam. Once the appropriate healthcare professional has completed the form, they will give it to you and you can submit it. Although they are completing the document, it is your responsibility to make sure it is turned in. We have discussed a number of healthcare requirements for you to complete, and it could seem overwhelming. If you have questions or need some clarification about the items you need to turn in, please contact your health records staff member. Once again, nursing students should contact Cindy Fowler. Ms. Fowler is located in room 130H, or you may contact her by phone at 941-8780 or by email at fowler.c@ptc.edu. Health science students, which includes all healthcare programs except nursing, please contact Denise Wiley in room 111H or by calling 941-8752 or emailing her at wiley.d@ptc.edu. These ladies are very knowledgeable and will be more than happy to answer your questions and assist you in becoming compliant with all health record requirements. Thanks for viewing this GROW module. Remember, if you need to review this information, this presentation is always available online at www.ptc.edu/health-science-resources. And be sure to take advantage of the other educational and informational GROW modules located throughout the Piedmont Tech website.